Thank you. And Dean Russell has a question.
Okay.
Thank you, Chair. And Joe, thank you for your testimony today as a witness.
Thank you.
It's been really enlightening. The question I've got is just about looking forward. Obviously, it's been an incredibly intense time the past few months with COVID, and the social care sector has done an incredible job, home care, social care, and also many, many unpaid carers that are out there. What would you say for the next 6 months, the next year? You know, what things should we be putting in place to make sure that there isn't burnout moving forward? And I'd also like to get your thoughts on career pathways for carers. I think one of the things that's come out in previous testimonies and what I've heard on the front line is the sense of actually, where do people go once they've become a carer? Do you think there should be better ways for careers long term that flip between the NHS and social care? And I was just interested in your views as somebody in that space.
Okay, yeah, but I think obviously funding is a big issue, isn't it? And I know this has been discussed, but I think that is a big issue. The availability of PPE. Also with regards to that. And what was the next question, sorry?
And just looking around career pathways as well. I was just interested in your view on whether you feel that once you become a carer, there are other options within the care system to be able to have a long-term employment, but also build a career.
Yeah, well, I think so. I think there's many options out there within certainly the agency that I work for. There is other options to go to. I think there is a career path. I think you could go and do anything that you want to do. You could go on to, it's kind of like, it depends how you view it. I think for me personally, I love this job. I'm happy in what I do as a care worker. I think some people could use it as a stepping stone to go on to nursing. There's many, many avenues for people to review and go down in care sector work.
Fantastic.
We have now Dean Russell.
Thank you, Chair. And my questions are primarily to you, Claire Murdoch. You were a witness for us a few months ago, and in that session, I asked if you would be able to let me know what's happening with regards not just helping NHS staff, and I absolutely welcome the announcement today, but also staff's family, because what I was hearing on the front line was that part of the anxiety for staff was the concerns that their family were worried about them whilst they were in work. And I wondered if you could give me an update on that, please.
Yes, well, many of the staff offers do also have a facility for families, whether that's resources, as Prerna said earlier, that you can share with your children, how to have those conversations with those who are worried about you. But other family issues that have come up are staff living perhaps with elderly parents, and how do we protect them? Also, many of the psychological services on offer have been extended where there's capacity locally to family members as well. And although that's not universally nationally, because we've prioritised our staff, many areas, and I will write to you with where they are, have also opened rapid access to psychological support to family members as well. Additionally, trusts even like my own, but there are many across the country who are doing this, are running sessions for staff about their families. So, for example, sessions were being run about anxiety around return to school back in September, and how to, conversations your staff can have with their children and youngsters, or their own anxieties about the youngsters going back to school. And these sorts of sessions, these webinars, these open sort of tutorials for staff are being massively well received. And of course, it's one of the benefits of a digital world. We're all frustrated about the loss of face-to-face, and when we'll all meet again face-to-face. However, what it has done is open a very big capacity for trusts and organisations to reach out beyond just their staff, but also to family members.
That's good to hear. I'd be very appreciative of the evidence around that and the details. Part of the NHS family, as it were, is also pharmacists, and I'm conscious that throughout the pandemic they've been absolutely at the front line of supporting the nation. I was just interested in your views on making sure that the mental health support extends to pharmacists, who have probably been in some of the most pressured frontline spaces of all the NHS.
Yes, and I fully agree. The pharmacists, community pharmacists and others have been incredible during the pandemic, and I've seen it with my own eyes, literally as well organising volunteers to make sure that they can get medicines to the vulnerable in their local community, as well as being a source of hugely useful advice and treatment, in fact, where it's appropriate. So I'd like to really echo that. Obviously, it's more difficult to reach out to a more forgive the use of the word, atomised workforce. So it's something that I'm really keen, now that we're formalising our health staff offer today, I'm really keen that we reach out and do make the service available to pharmacists. I think Prerna also mentioned something that's really important here, which is it's not necessarily, help seeking is not necessarily in the culture of health staff. So if COVID is to leave us some positive legacies, as well as the terrible trauma to society, I think I hope one of those will be that the conversation about emotional wellbeing, mental health and mental health support will advance exponentially. And I hope that our pharmacy colleagues will be part of that. So I can certainly give you an undertaking that now, today, we've formalised the staff help offer. We'll be asking areas to reach out.
And can I just ask another specific question, which is, again, sort of more evidence-based, actually. So one of the big terms that we've used in the session today is about resilience. And I'm just interested in an exploration around the evidence of why some people seem to have had resilience throughout the pandemic and others have not. And I just wanted to know whether there's been any exploration of whether that's because of working conditions, the environment, line management, support. I mean, I've heard so many stories from the front line when I've been doing my volunteering that actually the challenges are different almost on a ward by ward basis, not necessarily from a negative perspective, but I know during the height of the pandemic, nurses and staff were having to work in wards they hadn't worked in before. They were working in strange environments. There was a lot of additional external pressures. And I was just interested if there's been actual research done into why some have been resilient and others have not, and if that's been a workplace-based situation.
Well, I mean, I think your assessment of the difference that we see, whether that's in individuals or teams across the country, is a very fair one, actually. I think the first thing to say about resilience is, above all, we need to remember that it resides within teams, and the military and other colleagues have done a lot of research, actually, and there's a good evidence base that says, certainly from a work perspective, the more you get your team culture right, the more you have people like Bernadette running wards, who you heard from earlier today, the more your frontline management is right, the debriefs, the Schwartz rounds, the opportunity to contribute to your working patterns, flexible working. These million conversations that Prerna referred to earlier have been quite incredible, actually, because one of the things we've done is provide more training and support to frontline managers to have those conversations. And for some, it will be the first time that they've really talked to staff about, where are you living? Who are you living with? How are you getting to work? What are your anxieties? So I think the being heard is phenomenally important. But above all, resilience needs to reside within teams and all of the things we're doing.
And very just briefly on that point, are there measures around that you can share with us? You know, I appreciate surveys were shared earlier, but have we got sort of evidence of how that's increasing and the consistency of that across all trusts?
I do know that King's and other academic partners are very busily researching the impact of COVID on the mental health and psychological well-being of our staff. So I can certainly undertake, I was talking to Professor Simon Wesley only a few weeks ago about the range of research that's in place. And he's response to me when I was asking a similar question was, to be truthful, Claire, we don't know. There are similar world events to this pandemic, but it's pretty unique as well in the last 100 years. And so I do know that a lot of staff research is underway now, and we can certainly get you a list of that, because we're watching it like we're watching it very closely